Welcome back. In today's Trusted Advisor segment, we're visiting Harrison Chiropractic to learn more about peripheral neuropathy. So what exactly that is and how do you treat it? Take a look at this.
Maybe this holiday season, it's your time to finally feel up to par, to sit around with a smile on your face, pain-free, and get rid of the things as far as your back and your neck that are really bothering you.
Yeah, this is the season that you're gonna get your back straight, or your neck, or whatever else is hurting you, and that's why we're at Harrison Chiropractic to learn more. We're gonna learn more about neuropathy today. It's a big word. We'll break it down for you, plus tell you about how they're giving back to the community with Toys for Tots.
Well, as we mentioned, there's that really big term, peripheral neuropathy, and that's something you're very familiar with here. So what exactly is that?
Peripheral neuropathy is a disease that affects 24 million Americans in the United States. And it's a disease that attacks the nerves, and the nerves die basically because of lack of blood supply. It's very common in diabetics, people who had back surgery, spinal stenosis, chemotherapy patients. There's over 100 different causes of it that cause peripheral neuropathy. And it leads to severe pain and numbness and tingling in their feet, and they can lead to amputations in really serious cases.
And the loss of quality of life.
That's the devastating part. Most of these patients are older patients who are either retirement or close to retirement, and they want to spend time with their grandkids or golf or go swimming or anything to do with balance, and they can't get out of the chair because they're in so much pain. So one of the biggest things that I see it is people are just depressed because they don't think there's any help for it, and there's a lot of help for it. We have a great system that we use at our clinic. We've developed a system with about 300-400 other doctors across the country, and we go through a system where we get to the underlying cause of it. We get about 90% success rate with it. So you know, it's been very rewarding to treat because you give people their life back. Again, the main causes are diabetes, back surgery, chemo. So the reason that I really got into treating neuropathy is because I saw so many patients that were not able to do normal things, go for a walk, ride a bike, get out of the chair and walk someplace. And one of the #1 things that happens to people as they get older is they fall. And if they fall, they hit their head, you know, it can lead to put them in the hospital. They can break a shoulder, and many times they'll break a hip, and then they end up in the hospital, and you know that costs Medicare. Usually Medicare patients are the ones who are falling. It costs Medicare $300,000, $400,000, $500,000, and it's devastating to that patient.
All right. Well, let's go ahead and switch things over to my co-host Todd.
Okay.
He's going to go ahead and talk to you a little bit more about how you've been able to help people and some of the treatment options that you have.
Okay, appreciate it.
Well, now that we've heard what peripheral neuropathy is, let's find out how it's treated. How do you do that here at Harrison Chiropractic?
First thing we do with our patients, we look at their metabolic system, which is what their diet is. And we really look at their diet. We add some nutritional supplements to them. They communicate with us every day by text or by email during the course of the first 90 days of treatment. They come here once a week to get some treatments done here in the clinic that we do, some different therapies, different lasers and vibration plates and some other modalities that we use. At home, they're doing some things that we got from the Cancer Institute of America, a little thing called the Rebuilder. I use this for diagnostic uses too, which I'm going to use on you in just a minute.
Okay.
But they also use this as a treatment. There's some infrared lights, there's some vibration plates, and sometimes it's adjustments and massage. So there's several things that they do during that 90 days that they're coming in once a week.
So if someone is suffering from neuropathy in their peripherals, which is what this is, and those nerves are dying, with these different modalities, are we actually bringing nerves back to life? Are we re-energizing these things?
Yes, we want to give them hope. What we try to do is increase angiogenesis to get those capillaries going, so we generate the blood vessels which wrap around the nerves. And we do this with all the different modalities we have. And then once you get that blood flow going again, the patients begin to heal themselves, and they get great results. You know, and the other thing that was key to me, like I said earlier, is getting their balance back, because a lot of older people that are 60 and older, they start to lose their balance, and then they fall, and that's how they really hurt themselves.
Excellent. So you really are re-energizing, you're revitalizing those capillaries to get as you say, the patients heal themselves. The body's a wondrous thing.
Yeah, the body heals itself.
Now, you got these mittens here. I'm assuming these aren't your winter mittens that you wear outside.
No, these are a little diagnostic tool I use. When the patients come in, we'll sit down knee to knee like I am with you, and we'll talk to them to see what's going on with them, how it's affecting their quality of life. And then we run through what we call our 16-point examination procedure. There's different things with hot and cold and some other things. Then I hook them up to this little rebuilder, which I'm going to do to you.
Okay, what does the rebuilder do?
The rebuilder's got a 9-volt battery in here,
okay.
and it's going to be diagnostic. I'm going to touch your hands, and you're going to feel this.
So it's a good thing if I feel this?
It's a good thing if you feel it. When I touch their feet and go out and do my examination, a lot of times they won't feel that. So we're going to find out how far those nerves have died.
Okay.
Okay, so usually I'll go like this and I'll touch their hands.
So what should I expect here?
Well, a little poke, you might, just a gentle one. I'll be nice to you, I promise.
My daughter.
You know, can you feel that?
Oh, hey.
Yeah, so just feel that little poke?
Yeah.
When I do that to patients, they can't feel that.
It's like a
little
almost
tap.
like an electric jackhammer
like
saying,
little,
hey, wake up, wake up, wake up.
Yeah, now you'd be surprised. And when we do this on patients, and especially when their spouse is with them, we like their spouse to come along, they don't feel that. And that's, so we determine how much sensory loss they have. We have a formula we go through and we figure out if they're 30% sensory loss or 40 or 50. Okay. And then after that 90 days of going through treatment with us, coming here once a week and doing what we want them to do at home, we redo the exam again. And then I can tell them based on the results that they've achieved and how much better they've gotten, how often they have to continue to do the treatments at home. So we have really good patient compliance because our program works.
Well, if you're looking for that type of result in your life, you can come see Harrison Chiropractic, give them a call or check them out on the website. Really quickly though, you guys are not only helping people that come into your office, you're helping people in the community too, because you've partnered with Toys for Tots, right, this year? Yeah,
this year we thought, you know what, 2020 has been one of those years we want to put in the mirror in the back. So we decided that we're going to try to do 20 to 30 of these neuropathy exams before Christmas. And if a patient wants to come in and they want to bring a Toys for Tots for us, they can. They're not obligated to. We'll sit down knee to knee with them and go through our program and see if we can help them. But that is something our staff and my staff and I are pushing. We want to be the biggest drop-off site in Grand Rapids if we can. We want to fill the place with toys.
That's a great goal to have. Harrison Chiropractic helping with Toys for Tots. So it may be more than you think. It's not just coming in for an adjustment. As you heard, it's something with your metabolism, with your diet. It's something to do with so many different levels of how they can help you at Harrison Chiropractic. So whether it's low back pain, your neck pain, whether it's peripheral neuropathy, boy, that is a big word to say. Whether it's peripheral neuropathy, all of it can be handled and treated right here at Harrison Chiropractic. Thank you, Doctor.
I appreciate you coming in. Thank you.
Harrison Chiropractic is located at 2870 East Beltline Avenue Northeast in Grand Rapids. Just give them a call, 616-363-0902, or check them out at harrisonchiro.com.